All right, let's get started. Welcome to the American Indian and Alaska Native Behavioral Health webinar series. Thank you for joining us. My name is Jeff Ladolter, and today we have Durand Bear Medicine presenting on traditional treatment, concepts, competencies, and diversity. This webinar series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. We are part of the larger ATTC network, which also includes 10 regional centers, 5 international centers, a network coordinating office, and the National Hispanic and Latino ATTC. In the next couple of days, we will send out a follow-up email to everyone who attended, which includes a link to the recording, the handouts of the slides, and a CEU request form. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEUs for a $15 fee. Immediately following today's webinar, you will be redirected to our Gpra evaluation form. SAMHSA asks us to evaluate our events in order to provide improved performance assessment and accountability. And the survey we'd like you to complete asks about your satisfaction with the event, and it will take less than 5 minutes to complete. Completing these surveys helps us keep bringing you meetings like this one, and we would all appreciate you taking the time to give us some feedback. You will be muted for the duration of this webinar. Please use the chat pod to share your questions and comments, and we will address questions at appropriate points during the presentation. Today, I'm happy to introduce Durand Bear Medicine. Durand has held many positions in the Native behavioral health field. He has been a youth mentor, an addictions counselor, and currently he is the clinical coordinator for the Southern Peigan School of Health, a comprehensive school-based health program on the Blackfeet Reservation. In 2016, Durand graduated from the National American Indian and Alaska Native Leadership Academy, which is a leadership development program that pairs mentors with the next generation's leaders in Native behavioral health. And with that, I'm going to hand the presentation off to Durand. Can you hear me okay?
Okay, perfect. So, first of all, I want to thank you for the introduction and sharing the things that you do. And I'm very happy and fortunate to be a part of this process, to share what I can. I think that's one of the things that culture kind of really does on our side for me, is to really enforce that and follow through. So I was fortunate to be a part of the Leadership Academy in 2015 and then carrying into 16. But let's see if I can get closer to the mic there. Sounds like we're having problems with that. Can everybody hear me now? Okay, so I seen a comment there about that. Okay, so one of the projects that I focused on there, I firmly believe in cultural treatment, traditional treatment. And so it was something I was raised with here on the reservation. And actually part of my introduction, I usually say my name is Oki Nistua Nitaniku Makgoisikan. It's my Blackfoot name is Wolfrobe, and that's my traditional Piikani name. And so the gentleman you see here on this very first slide is actually the gentleman I'm named after. It's my great-grandfather, Fish Wolfrobe. And he was a member of the Blackfeet tribe, spiritual man. And he was one of the last camp criers that we had here on the reservation, which died out in about the late 60s. And so it's a family, kind of a family-oriented thing, that being raised in it, that I believe in it, I trust it. And I know that it's something that is going to lead us into the future. One of the big reasons why I took this project on and to follow with traditional treatment was for that purpose. Is I believe that um, us as cultural people, we know how to heal our people. We know what works. There's a lot of different concepts and a lot of things out there in this world today. But each region, each individual has to be handled different. And so my perspective is coming from dealing with that from the region I'm in and kind of trying to broaden it enough to where people can understand it, people can follow it, and take what I have and implement off of it and kind of use it and tweak it in their own way. And that was my goal and my intention for this presentation I have today, to kind of go off of that in hopes that I can inspire people to move forward and do traditional treatment as they see it. So I want to clarify that what I'm sharing today isn't something that I want to force on people, but I believe if there's something here that you think can help, I want to encourage you to take and use it the best that you can. But I'm explaining it from a concept that I understand. So for that part, that is the name of the webinar, the presentation, and that is my great-grandfather, Fish Wolfrobe. These two individuals have been a part of my journey as well, Sheridan Ground and Daniel Edwards. They were part of the two young gentlemen that helped. We were part of this implementation of cultural treatment when we all worked at the Crystal Creek Lodge Treatment Center. We were a part of the treatment team there, and so we helped along with Dr. Joe Gahn and Pat Catholic kind of implement this into our program and kind of use that to our advantage to help our people, those Native people that came to our inpatient treatment center. And so our goal was to introduce cultural concepts to them, but adopt in some of the things, whether they came from the Rocky Boy Reservation, Fort Peck, Fort Belknap, but how would you apply that to the Blackfeet? How does it compare? How is it different? How do you think they kind of mesh together? Those kind of things. And so we wanted to make sure that we allowed people to be who they are and discover who they are. And I think that's been the whole goal of this. So I'm really thankful to these two young men for being a part of my journey and kind of adding some knowledge to what you're going to see today. So as we stated, my name's Durand, Bear Medicine. I'm married. I've been married for the last 8 years, but been in the relationship for 18. I have a daughter named Kaylia Bear Medicine. She's 14 years old. I'm a member of the Skapi Peigan Nation, a band that belongs to the Blackfoot Confederacy. But I'm also a member of the Assiniboine, the Sioux, and the Cree tribes. My Piikani name again is Makoyisikan, translated as Wolfrobe. And as we go back to that slide, I'm also a lead singer and a co-founding member of our drum group, Young Grey Horse, who was a Grammy-nominated drum group that was established in 1995. And part of my accomplishments with the drum group has been traveling the United States and Canada, representing our tribe with our drum group. And I've had the privilege of using my talents with song making to compose a movie, a song for the movie Slaughter Roll. If any of you guys haven't seen that, stars Ryan Gosling and a few other people, but we are on there. Part of my education, I graduated from Browning in class of 97. I've been a graduate of the Blackfeet Community College, kind of skipping around in various areas of study, wanting to do things. So Blackfeet Studies, Criminal Justice, Human Services, Social Work and Counseling, and Chemical Dependency. And currently I'm enrolled in the Montana State University Northern, participating in the Community Leadership Program. And hopefully to be completed with that by the end of the year. That's my goal. So I'll be pursuing my bachelor's degree in that. Part of my certification and acknowledgements, I am a Montana State licensed addictions counselor. Again, you see my license number there. I'm presently still licensed. A member of the NADAC, a member of MADAC as part of their board here in Montana. And then I've also reinstated my Northwest Indian certification. So it says I ended it in 2014, but I just reinstated it a few months ago. So I'll be getting that certification back. Member of the Montana Board of Behavioral Health as an LAC member. And then I've also been a part of the Leadership Academy in 2016 where I graduated. And so part of the work experience I've had has been in working in tribal court as a home arresting officer, being part of the Blackfeet Youth Initiative as a youth mentor, counselor. I've worked at the treatment center here in Browning, Crystal Creek Lodge, starting from the bottom of the chain as a unit tech and working my way up there. You can see the work history as an outpatient aftercare counselor, health and safety, clinical, and one of my last roles before I left the program was as the acting director. So I've actually been able to climb that corporate ladder and gain knowledge the way that I wanted to. And so I came over to this program, the Southern Peigan School Health Program, that we've recently opened about 3 years ago here on the reservation to provide health care to our tribal youth, our reservation youth. And so I came on as the clinical coordinator for that. So that is a little bit of history about who I am and what I've been able to do in part of my career. So part of the presentation that we'll be looking at, these starting out, some of the frequent questions that we were often asked about traditional treatment. And as you see, what is traditional treatment? How is this form of treatment different than standard drug and alcohol treatment? What can I learn from it, or what should I expect? Where can I find this kind of treatment, and can anyone teach it or be involved in it? Those are a few areas that I'd like to kind of elaborate and touch on today in hopes that I could share with you guys to offer what it is that we can. Of course, you see in the background there one of the traditional Blackfoot teepees with the paintings that we have here within our tribe. So that's a little piece of cultural significance that we have. So the first question, what is traditional treatment? So part of that, we had to kind of come together and think about that. What is traditional treatment? How could we make that our own? How could we define that? Those types of things. So we really had to research and kind of ponder about what it is and what that statement means. So part of it, we talked to a few elders here on the reservation and asked them, what do you guys think traditional treatment is to you? How would you help people in these various areas? So here's a statement that some of our elders gave us. The traditional practices of an individual's tribal beliefs, one's choice to follow his, her own cultural ways of often incorporating the use of tribal customs, values, and practices that may be associated with ceremonies, sweat, songs, dances in consultation with elders or spiritual leaders. So those were some things that our elders said, don't forget this, let's rely on this way of life. Here's what we believe. Here's how we want to help our people. So it's through the use of those items that's listed there that we will be kind of seeing throughout the presentation here that we've been able to use and implement in our area of study and practice. So we had to look at the non-traditional aspect. What is treatment? How is it defined? So when I worked at Crystal Creek Lodge, we were actually accredited by CARF, so the Commission on Accreditation of Rehabilitation Facilities. And in their manual, standards manual, this is how they defined treatment: a professionally recognized approach that applies accepted theories, principles, and techniques designed to achieve recovery and rehabilitative outcomes for the person served. So we saw that as a very similar concept in definition that we portrayed in the slide about traditional treatment. You know, the language is a little different, but in theory, everything is as it should be. And so we make it what it is, we make it what it needs to be, and the people will define how it's going to help them. And I think that there's no right or wrong way that treatment, addiction treatment, and mental health is moved forward. I think it's how the person moves forward themselves. And so this is the concept that we use for treatment from a non-traditional aspect or perspective. So 3 key areas that I wanted to focus on in this topic is the concepts, the competencies, and diversity. So what you'll hear throughout this presentation is through these areas, I'll kind of elaborate off the slide in a little bit of area, so that way what I might talk about may not be on the slide, but it will apply to the slide itself. And so I want to kind of elaborate those areas. So here we are. Here's how was this form of treatment different than standard drug and alcohol treatment. So through my research and putting this presentation together, we wanted to look at part of this. If you look on the left, you'll see a slide. What we typically would look at what counseling might look like. Interaction between 2 individuals, one being the healer, one being the one that needs the healing, the acceptance of that. And so that is how we would visualize that from a non-traditional perspective. Here's how we're helping others. This is how we hope to help people. If you look off to your right there, you can see that this is one of the traditional picture of actually one of our Blackfoot elders from the early 1900s, probably about 1930s, 40s. And he was a traditional healer, part of history. And if you could see that his power was with handling poisonous snakes, he would prove himself by sticking that snake in his mouth, not being bit, and proving to the people that the healing powers that he had could be visualized and seen there. And you see the people in the background observing. So in comparison to these 2 on the slides, this is the non-traditional and the traditional aspects of what helping others might look like. And how do we bring that together, and what do we do? So healing itself has been around for a long time. And so that's what I wanted to visualize and capitalize on within this slide. So part of the concepts that we looked at is here the non-traditional versus the traditional concept. So in I guess one of my spiritual elders, we talked about the non-traditional world versus the traditional world, which I guess I can put it this way, and I don't mean any offense, but here's how I've conversed with one of our elders, but he's always said we do it in the cultural way, and then he called it in the white man's way, the white man's world, what we say, because of the westernization, all of that. So I mean no offense by that, but it's the way that I could kind of bring that picture forward. So non-traditionally, we look at today's world. We have the psychologists, we have the counselors, etc. Those people that are in these positions to help people. They have treatment plans within the treatment and mental health field that, one, identify the problem, the goals, the objectives, the methods, and how to help, and deadlines. How do we achieve this within a standard period of time? So we're always, you got to be 45 minutes, you got to be an hour, those kind of things. So the support resources we have, AA, NA, the meetings, Al-Anon, church, cursillos, pilgrimages, and then we have, the credentials and the licenses that tell us who we are and what we are in this world. So the accreditations, the degrees, professional licenses, national and state standards, administrative rules, ethics, etc., anything that is out there. And so then traditionally we had our elders, spiritual advisors, medicine men and women that were taking the place of these psychologists and counselors. We had activity plans that we did in our cultural treatment that we did a few years back, which outlined pretty similar to the treatment plan. We identified the problem. We incorporated a daily schedule to achieve that, to help with the goals and the objectives. But they weren't time-based, because in a cultural aspect, if you look at the background of the slide, perhaps one of the traditional ceremonies they're sitting in, our elders never rushed. They did everything in the manner it was supposed to be. So they didn't say, well, this pipe ceremony is going to take an hour and no more, no less. They did it, and they started when they did and they ended when they did. So we tried to use that concept in our activity plans. The support resources that we've had in the traditional side has been the sweats, ceremonies, prayer and the smudging, the social gatherings in powwows, today that we've had. And then in the background, we've had the honors and the earned rights and privileges of our high-ranking people, those elders and spiritual people, which gave them the right to transfer names, to paint, to be pipe carriers, lodge and bundle holders and keepers, protocols. They practiced protocols, implemented virtues, ethics, and guidelines. So side by side, you can see the similarities in how they would probably work together, but you can also see the difference between how they're defined in the non-traditional world, Western world, and the traditional world, what we see on the reservation in a lot of our urban areas that with individuals that practice traditionally. So you can kind of compare that and see one of the things I've talked about with credentials and licenses. We've always needed that degree on the wall that said, here's what I did. We have a little card in our wallet or purse that says, I'm able to drive. Legally, I can drive. Or for a tribal, I have an ID that tells me how much blood I am to be a Blackfoot member. But you go back to our old way, we didn't need those things to say who we were, because we proved that stuff through honor. We proved that stuff through these earned rights. And we had to practice it and show it every day. But we would never say you need a license to be a pipe holder or to run a Sundance or any of that stuff. Because a lot of our elders, they would probably smack us on the side of the head when it came to that as a sign of disrespect. Never questioned me because I've lived a strong life. So that's how I've tried to break that down between these concepts. And so you can kind of use your own imagination and kind of play with that and how you would define that in your own way. What does that mean to you? So part of that are elders, spiritual advisors, medicine men and women. Here's what it would typically look like. We see our women, we see our men, high ranking in our cultural life. These individuals are part of what we have, we call the Ginaptumitex, is our Crazy Dog Society, one of our police forces for the Blackfoot tribe. And so they were one of few groups that we relied on for safety, for protection, to police our encampments. And so that society is still alive today. But what you see in the slide is how it's being carried on through the women's world, through the men's world. We see the young female and the young male both being mentored and being taught and led into the circle the right way with these elders, these people that we rely on to be teachers, mentors, leaders, instructors. And we typically define that by their traits, which are knowledge, skills, the wisdom, values, and guidance. That's what we rely on our elders for. So we're not going to say that these two individuals would typically need a degree to be where they're at or a license to do what they do, because we rely heavily on those cultural concepts to guide that. And that's what we've done throughout the cultural encampment. Here's part of what we did for the activity plans. We've done some of the daily events, which weren't hourly based again. In the morning, we might have a prayer session where they wake up with the sun, typically a custom that isn't practiced a whole lot anymore, but traditionalists that still live our way might still do. Because some of us are used to sleeping in, and time we get up, the sun's already up. So that's part of that old way of getting into that. So we might incorporate a prayer session where we smudge, we make offerings and ask for direction that day. And we might open it up with a pipe ceremony and get into things with activities, crafts. How do we do these things? So as you see on the slide here in the picture is one of the spiritual circles that we've had as a group, to where the elder and his helper is kind of instructing this group of what they're doing. Might be a smudge ceremony or something, but that's kind of how we did groups on a daily basis, teaching them about what it is to practice this way of life. And then so in the afternoon, we might incorporate a talking circle, storytelling, and they might participate in a ceremony because the elders feel that this needs to be taught, not videotaped, but taught. If you want to learn it, you sit down and you learn it this way, because that's how our culture is based. We're oral, we're visual. We don't go back to books to look for that stuff. If it's gone, it's gone. But if it's here, we learn it this way, because that's the only way that we do it, is through hands-on activities. So that is part of some of the activity plans that we did typically within the groups that we did in this cultural treatment. Here we see the practicing with the traditional ceremonies for therapeutic opportunities, a chance for healing, prayer, smudging with the sweetgrass, cedar, sage, sweet pine, whatever is available, and a concentration on an individual's identity. As you see in the slide, the Okan was one of the most important ceremonies of the Blackfoot people, and offers were made to the sun, the Napi Natusi, every year. And so part of our spiritual ceremonial, this is one of the old arbors that was erected a while back. But this is to signify, as you would per se a church, where we go to pray. We come together to listen to someone speak about a way to heal, a way to pray, and how do I make that connection between myself and the Creator, the one above, the higher power. And so as we say, let's allow them to concentrate on their individual identity. What does this mean to you? I could tell you what it means, but what does it mean to you? And what is your definition of how this thing has helped you? So this was part of the things that we tried to engage them in and teach them about, because this is an important ceremony that still goes on today, but is very influential in letting people know this is still alive in our community today. But it's up to you to pick it up and use it when you want to. Here you see some of the pictures that we have, which allowed our patients and our clients to participate in different types of activities that maybe that was done years ago. You know, how to make moccasins, or how to make a drum, or make rattles. These were the activities that we tried to engage them in, wanting them to understand that there's more to life than being lost or being involved with alcohol or drugs. Those are the things that we looked at. So trying to distract their mind and let them know, here's a new thing to occupy yourself with. If you say there's nothing out there, then I believe you're wrong, because there are things here in front of you that you need to become aware of. These are things that your people have lived off of and practiced. Here's who you are. So those are some of the activities that we did have, that we did share. Part of those competencies that we had is the rights to put on sweats that were earned, and that it took skill to put one up, following the protocols and the safety precautions that were taught and passed on by our elders through generation to generation, and knowing when it was used and to use it properly, and and have the ability to assist those suffering from ailments and sickness, disease. And so, this was a way for people to come together in another ceremonial aspect to pray, but also a form of healing, kind of in a traditional doctoring sense, a small health clinic, an area to go get help. So here we had the sweat lodge used for purification and signified in being the womb of a mother. Being dark, you sit in the dark, it's warm, it's comforting, it's safe. And that's why our people said it's almost as if you're inside a person that gives you life. When you come out, you feel the cleanliness, almost a rebirth and rejuvenation, because you feel good. Things have escaped your body that you left within that area. And so you go back to there, I see where one of the examples, we had a client that came to our treatment center before, came to the traditional encampment, who was detoxing off of meth. And this individual was very sick and was ready to walk away and say, I can't do this, I can't handle it. So we encouraged them to talk to one of our elders. The elder encouraged them to come through the sweat. Come give this sweat a try for a few days. And if it can't help, then you're free to go. So this client came in and went through the sweat. Here, this individual had detoxed themselves through the use of this cultural practice. And they stayed for 45 days, completed the program, and they walked away feeling good about themselves. But this was one of the understandings that we use this process to help an individual. And through the use of it, they help themselves. So to add to that, part of that, the evidence-based stuff, we've used and seen it happen where they detoxed and stayed and got themselves clean by getting rid of the toxins through this process. But it's been around for years, and a lot of our tribes use it, and it's still practiced today. So that's one of the evidence things that I wanted to share, that what this can do and how it can help individuals. So coming back to with the traditional and non-traditional, Native traditions, were taught and learned through the oral and observation, as I spoke about, i.e. the language, ceremonies, prayer. And knowing the community and the values of the individual, what is the behavior? Communication, many Native Americans excel by talking, sharing, versus writing and reading. So you see that picture behind that side of the slide is typically what our classroom would look like if you sat in with a group. You encourage your young people to come in to see what's going on so that they too can learn, but they can also pick up on those values and answer that question. What is the behavior? So by them seeing and doing this, they learn, they excel, and that they practice the behavior of being good to one another and carrying on something that is structured as this. So we come to the non-traditional side, the education, history that was taught in the schools, universities, through books, videos, the audio, classroom, and typically a classroom setting. And that's done through communication. And so as you've seen, I've put the Caucasian or Native American professional sympathizing. One of that, I guess an example of that would be if we were going to sit in a classroom and talk about history, talk about things how we want people to learn, it's often hard to do that. And with my example there, it would be hard for me as a Native American, or as friends of mine who are Caucasian or any other ethnicity, that we could sympathize per se with an African American about the pain and suffering that maybe their ancestors have endured, possibly from slavery, civil rights. If we sat down, if we went to school and said, well, here's how you got to apply counseling techniques in school. Here's what you got to do for therapy. Here's how you got to handle grief. Here's how you got to handle this. and we become persistent about that, we cross a boundary where we might, cause an individual to walk out mad because we don't understand where they're coming from. So with this example, myself, I could not come and say to an African American individual, I can really empathize with what you're going through because I know what you're going through. I've been there because we weren't there. I wasn't there. So for me to make that connection would be a little hard. But if I use the communication skills from school and stayed within those confines, I might not ever have breakthrough with that individual. But if I communicated in a way that I could just sit there and listen to them talk about it and not be forceful and say, well, ethically you have to do this because this is what the confines of counseling talk about. This is what ethics are about. And I think there's a fine line in how you draw that and still remaining ethical, but from a cultural aspect, we sit, we listen, we understand, but we don't ever say, this is how you got to get over it. This is how you got to do it. Right? That saying goes, we can lead that horse to water, we can't make him drink. But I think a lot of times our educational and our history, the way it's enforced through school, sometimes can lead down that path. And again, that's just my take on it, because I've been and experienced it actually. So that's why I speak about it, is because I believe that each case is handled differently, so you're going to have to make that breakthrough by bending the rules a little bit. And you might not typically apply things that the counseling or any of that apply through, so you make that connection somehow. But there's a difference between those two classrooms there on the slide. One of the things that we talk about with this treatment, and as you see the picture there on the slide, is a picture of myself. In the background you see a picture of my late grandfather. His name was Wayne Bearmedicine. He was a traditional teacher here. He was a fluent speaker of our language. He taught history and the language within our Browning public school system. And he was my father. He was the one that had raised me from the age of 6. And I look at the slide because it signifies what we want to promote within this process. We want people to have that identity, seeing who they really are. What have I learned? Finding strengths and weaknesses, always knowing there are choices, and living culturally expects sobriety, but it doesn't mean that you can't come around if you aren't sober. But we want to encourage you to follow. If you are going to follow cultural practices, you do kind of need to be clean and be cleansed that way. Everything hits you perfectly. And so with this picture, the reason why I included it is because it came about from an experience I've had. I was doing the same presentation, myself and those two gentlemen. We did this presentation about 4 years ago at the MADAC conference in Butte, Montana. And I was talking about my grandfather, the way he taught me and raised me and what I learned from him. Well, you could see our shirts are identical in the slide. And I had a replica made of that shirt because I could not find the original. And I think it was buried with him, but one of my sister-in-laws made a replica for me, and I wore it. And so one of the individuals from this conference approached me during one of the breaks, and he had asked me about if I thought my grandfather was there, if I felt he was there. And so I told him, I don't know. I said, I feel like he's with me all the time. He said, well, I noticed something about you. When you got up there and you talked, he said you were speaking. He said you were very clear. Your posture was strong. And you spoke with confidence. He said you were a different person. He said that when you handed the microphone over, he said, you gave it to one of your buddies and you went and sat down. He said you limped over and you were kind of hunched over and kind of sitting there. He said, and you looked different. You looked younger. He said, and then next thing you got back up and you grabbed the microphone and you start talking. He said, and you changed again quickly. He said, he said, I seen two different people here. He said, so do you think your grandpa was with you? And I said, always, all the time. So to me, that's my identity. The way this picture is collaborated, that's how I see myself. I see my grandfather in me, and I'm sure that he sees himself in me as well. So that's what I'm hoping to do with this, is that I want people to find that ancestry, looking in this community. Who is your family? Where do you come from? And what are your strengths? What were their strengths? How can you apply that to who you are today? What are your weaknesses and how can you overcome that? But knowing your choices, that you have to pursue things, not just say it, but you got to do it. So that's what the significance of this picture and why I brought this up, because that is something that spoke to me, and I cherish that concept and that memory moving forward. So we asked the question, where can this form of treatment be found? I put, for the most part, most reservations consist of these resources. Traditionalists that occupy many of the communities, elders, people that are still carrying on this way of life. There's urban areas that are occupied by Native Americans who have access to these resources. Places like Great Falls, Butte, and other places that might just have individuals that left the reservation and never came back, but are still aware of their cultural practices, backgrounds, and that can lead and guide you to these resources of what and how to practice culture. And in general, wherever there is culture, there is traditional help. And so typically it's found in those three areas. When I speak about diversity, I want it to be kind of the goal of this presentation, is I want people to be able to understand that it can be learned and processed and carried on by not only Native Americans, but everybody that's willing to learn it. Anyone that can teach it or be involved. So if you look here at the slide, if you look on the left, is a picture of my late grandmother. Her name was Mary Ground. She was a Blackfeet elder, fluent speaker. She was also a person of ceremony, but she wasn't Native American. She was raised in our tribe when she was a baby. She lived to be 107 years old, but she was white. She wasn't Blackfeet at all, but she was raised in it. And she became one of our strongest, most powerful leaders that we had in the tribe. And the story of her is she was found, our people some years ago found her. She was stuffed in a badger hole. And they pulled her out, and they took her and they raised her. And that's how she became a part of our tribe. So that's a little piece of history on one of the Blackfoot elders who was not an enrolled or member of the Blackfoot tribe, but she was raised in it. The gentleman you see on the right, his name is Bartosz Stranz, and he comes from Poland, but he's lived in our community for quite a few years now. He's married here. He has been practicing and been a part of our culture for a while. He's been able to pick up pieces of the language, bits and pieces of the ceremony, but he also understands not to cross into areas where he might not be permitted to, but he's willing to learn it. And so if these two individuals can understand it and have the willingness to pick it up and ask their questions and follow through, then I believe, yes, it can be taught and it can be passed on to other people that are willing to learn it. And so in the mental health and the addiction process, we want these concepts to be passed on and learned by everybody and anybody. How do I teach this? How can I incorporate this into my program and make it my own? So this is a little piece of that, how we explain diversity. Here's just a little bit of numbers that we did from the time that I recorded it when I was at the treatment center, of how we improved in our cultural. So you can see in 2012, we only had 10 participants, part of the experimental aspect. We had 5 that completed with staff approval, 5 that didn't complete. But all in all, we had 10 people that participated in that general practice of cultural treatment. The next year, you see the increasement. We had 14 people that participated, 13 people completed, 1 didn't. So that was a success for us to say something's working here. 2014, you see it again, it's growing. We had 23 people that had participated in the cultural encampment. 17 of them completed, the other 6 didn't. The following year, we had 41 with 25 that completed, 16 that didn't. But you see the gradual increase that came, the increase in there. And then in 2016, it dropped a little bit, but it wasn't very significant. So it stayed at 36 with 26 that graduated, completed the program. So through these numbers that I've offered, that is the process that shows that what we were doing did display some success and gave people the opportunity to follow through and do some of the things that we did. And so to me, that is evidence that applying these concepts and these theories and these practices can help people if they're willing to do it. And so I'm very proud of the success that I was able to see recorded here on this slide. And so part of the conclusion here with the acknowledgements and the resources, we relied heavily on Dr. Joseph Gahn. Many of you are familiar with him, and if you're not, I would have a look at the video that I've included there. I'm sorry I didn't include the link, but that was the name of the video on YouTube, which You've Got to Prove the Power. He talks about the ceremonial stuff that he's seen and heard stories about on the Fort Belknap Indian Reservation and what sparked him to pursue cultural treatment practices. But he helped us pioneer this project into our community and how it became reality. We're very thankful for him. My acknowledgement to Pat Cathlicking, who was my former director in Boss. He was at the Crystal Creek Lodge Treatment Center, a mentor of mine. Again, Daniel Edwards, who was our cultural counselor and a member and part of the societies that were listed in this presentation. Sheridan Ground, who was also a member of the traditional practices, but he was also our Prime for Life and DUI instructor. And then Rick and Elsie Ground, who you've seen as the spiritual advisors on one of the slides with the young individuals in their laps. And then also my mentor that was in the Leadership Academy, Mr. Raymond Slick from the Meskwaki tribe. He was very supportive in me pursuing this project in using it to incorporate a balance between my professional, my personal, and also the cultural aspects. And how can I pass on some knowledge that I have to help and inspire others to move forward. So those are a little bit of the acknowledgements that I've had. And I do apologize, I believe there was a link sent out to this video, but the way the video portrays on YouTube is a part of our drum group in how we've participated at powwows and sang. But there's a little bit that goes with this video where I talked about, you could see myself messing with the drum in this video. You could see me. Well, I was gifted the right to be a drum keeper for our drum group. And I carry that role and I do it seriously. And that allows me to be sober. You see myself there messing with the drum and kind of functioning it. So that drum is at my house, kind of like an altar area where I have my smudges and my different things. And I take care of it as if it's alive. The spirit is alive. And so I've been a protector for that. And it's been a big part of my life that's kept balance with who I am. So being able to practice this singing and the drumming, we're carrying on a family drum group, carrying on something that we can be proud of, and we'll always have that, brings us together, but we bring it out and help people through our music. And so that is part of what I do. It's part of the way I can give back to my community, give back to other people through my music. And when I compose songs, that is for a purpose, that I believe the Creator gives us these gifts to help people heal through the heart, through the body and the mind, and that we come together in that aspect. So that's what this video is about. And if you watch it, you could see how passionate we are about the drum there. And so as you see myself there with the camouflage hat, the gray shirt, one of the founding members of this drum group, I'm very fortunate to carry on my grandfather's legacy as one of the lead singers of the Young Grey Horse Society singers from the Blackfeet tribe. So with that, I will end it here. And that is part of what I wanted to express with my practices and what culture means to me and what traditional treatment is how I see it and how I want to encourage people to follow through and live it, practice it, walk it every single day and get to know who you are. So with that, I'll leave it at that.
Okay. Thank you so much, Durand. I want to open it up to questions. I'll just keep this video playing while we're here. I also want to let everyone know that we are currently accepting applications for the Leadership Academy, which you heard Durand talk a little bit about in the beginning, and I will post a link to that in the chat as well. But if you have a question, please just type it into the chat. We can address it. I have a question from Teresa Moses. She noticed that only the race ethnicity options on the application for the Leadership Academy are all Native. Does this mean only Native Americans may apply? And I think our program manager, Monica Rossi, is here on the call, so she may have an answer for you.
I also just wanted to add too that anybody that's interested in the leadership, the academy, I'd certainly encourage it. It was a very great experience. I wasn't ready for it. I really wasn't. I was hesitant about going, but when I got there and got involved in everything that came with it, I felt good when I left. And a lot of the things that I gained from there, I carry now forward in my professional career, and it is something that has certainly helped me develop as a person and as a professional. So I would highly encourage individuals to look into the Leadership Academy. It's been a wonderful experience, and I would not change a thing. If I had the opportunity to apply, I would certainly do it.
So it looks like we have a question from Philip Hudson too. Um, is registered in Canada. Is a question: are Canadian Indians eligible for acceptance into the leadership program? Um, Philip, in your situation, I think it might be best to uh, reach out to Monica Dreyer Rossi individually. Monica, would you mind posting your email in the chat box? All right. Well, it seems we have no more questions, so I want to thank Durand Bear Medicine once more for sharing with us today, and I want to thank everybody on the call for joining us. As soon as I end the meeting, you'll be prompted to complete a short 5-minute survey, and we would really appreciate it if you took the time to fill it out. Durand, do you have any last words that you want to address?
No, I guess I was just going to. Maybe I know there might be people that wanted to ask questions, maybe not on here. So I don't know how we would want to possibly give them the email that I have, or even my cell phone. I would be willing to answer questions for people that just have questions outside of this webinar.
Would you mind posting that in the chat box?
You want me to list down my cell phone number?
If you're comfortable.
It looks like it's not allowing me to type anything here on the chat.
All right, I'm going to close out now. Thanks once again for everyone.